Hello and welcome to Nursing Bites by Nadia. Today I'm going to continue my Fundamentals of Nursing series and we're going to talk about nursing research. There are two basic methods of nursing research, quantitative and qualitative. Quantitative research consists of basic and applied research. Basic research is called pure or lab research, which is designed to generate and refine theory. Applied research is also known as practical and is designed to directly influence clinical practice. There are different types of quantitative research. Descriptive research is used to describe events, concepts, identifying relationships between events used to generate new knowledge. Correlational research evaluates the type and degree of relationship between the variables. Quasi-experimental research examines cause and effect relationship. Experimental research examines cause and effect under highly controlled conditions, often in a lab setting. Next, I would like to introduce you to terms frequently used in research. Variable. Variable is something that varies and has different values that can be measured. There are two types of variables, dependent and independent. Dependent variable is being studied, determined as a result of a study. Independent variable are causes or conditions that are manipulated or identified to determine the effects on the dependent variable. Hypotheses is a statement of relationship between the independent and dependent variables that the researcher expects to find. Data is the information the researcher collects from subjects in the study expressed in numbers. Instruments. Instruments are devices used to collect and record the data, such as rating scales, pencil and paper tests, biologic measurements. Instruments should be both reliable, produce the same results on repeated use, and valid, test what they're supposed to test. Now let's move on to qualitative research. There are several qualitative research methods. Phenomenology describes experiences as they are lived by the subject. The analysis of data gathered gives information about the meaning of the experience. Grounded theory discovers how people describe their own reality and how their beliefs are related to their actions in social scene. Ethnography stems from the discipline of anthropology and is used to examine cultural issues that are of interest to nursing. Historical qualitative research focuses on the past events to improve understanding of nursing profession today. Many of these studies are based on nursing leaders. Now that we know about different types of nursing knowledge and research, that leads us to evidence-based practice. Evidence-based practice can be defined as utilization of the research findings by the nurse in her daily work to improve the quality of nursing care. Another aspect that is important to understand in nursing knowledge is hierarchy of knowledge. It is important for a nurse to understand which source of information has the highest degree of accuracy. So the highest level in the hierarchy of knowledge belongs to the systematic reviews because they examine multiple, sometimes hundreds of studies on the same subject and make conclusions based on the results of those studies. Expert opinion is all the way at the bottom of the pyramid. In regards to the hierarchy of knowledge, you might see a question similar to one that would ask you, if a nurse manager is looking for a way to reduce rates of C. diff infections on her floor, which source of information should she choose to base her quality improvement project upon? You will then see several options from the hierarchy of knowledge and then should pick the highest option because it would give the nurse in the question the most thorough research for her project. So I hope this gives you a little bit of understanding about nursing research. And please comment below if you find there are any other topics of interest to you. I will try to make those videos as soon as possible. Thank you.